Hello and welcome everyone. My name is Aida Araisi, and I am very pleased to welcome you to another episode of our Global Rebound 2021 series. It's going to be a great topical discussion on travel. And in fact, today marks the 1-year anniversary since the World Health Organization declared COVID-19 as a pandemic. In this last year, the virus has changed our lives drastically, and it has changed consumer habits, and it has changed industries. And perhaps no industry has been as affected as the travel and the tourism industry. So today we've got some really great representatives, one from one of the largest airlines in the world, United Airlines, and the other from Atlanta Airport, one of the busiest airports in the world. So we're hoping that they're going to share their perspectives on how COVID has affected them, how they've addressed those challenges, and how they're mitigating future risks, and how we can all get back to traveling. Infectious disease experts recently are starting to give us some light at the end of the tunnel. We're seeing vaccination numbers increasing and COVID cases decreasing. So we're all starting to feel hopeful, and I'd love to allow our speakers to give us a little bit of hope as well. So our first speaker is Rodney Cox. He is the Vice President of Airport Operations for United Airlines. In his role, he's responsible for daily operations and approximately 500 flight departures and arrivals per day. He oversees 3,500 airport employees and who ensure a safe, comfortable, and on-time customer experience for more than 15 million customers annually. Our second panelist is Balram Budari, otherwise known as B, at the Atlanta Airport, and he is the Airport Deputy General Manager with over 30 years of aviation industry experience. He oversees public safety and security, operation maintenance and transportation, planning and development, on-site facilities, and asset management. So welcome to my panelists, and let's start with Rodney at United Airlines. Rodney, if you could give us and the audience some thoughts about how you guys as an airline have ridden this out and what you see in our near future.
Aida, thank you very much for inviting me to participate today. It's a pleasure to be on the panel with B, and I just got a chance to meet B just a few minutes ago, but I know between the two of us that we're going to share a lot of great things, one from the airline perspective and from B's side, kind of the airline facilities or the airport perspective as well. So what I would like to do is kind of walk through, I have a short presentation with some slides that I would like to present. What I have found in some of these other sessions that I've participated in is that our business travelers would really like to come back flying, and they like to come back to the facilities, but they're not quite sure what to expect. And so if I can indulge everybody and run a presentation, I'd like to do that this time. So that is our video that kind of demonstrates our United Clean Plus program that we've initiated since COVID-19 has started. And what we like to do is we kind of like to walk through and take you on a field trip from the beginning of your journey when you walk through the front door until the time that you land, to show you that this is actually a real life practice that we have in place today. So when you come in through to security, the first thing that we have available, which is new to United, is our Travel Ready Center, and this new platform, which you can actually access through their united.com or the mobile app, is a Travel Ready Center, which is a place where you can actually go and receive and find out all of the entry requirements that you need to know for each and every country that you're traveling to. You can look up what tests are required. You can find out what testing options are available for you both in the US and overseas. You can upload all of this documentation into your iPhone and your app right here and have it with you and be ready to show it and have it available at all times during your journey. We also have an opportunity for you to ask for, and we'll send you a link when you book a flight, for an opportunity to take a test at home. And these are self-administered, self-collected tests that you can have mailed to your home. You can take the test, you can UPS it back to a lab, and you can receive those results for your tests within 24 hours of when you actually need to travel. What's nice about this is that a lot of times people don't know where to go, where to find a facility that will help you get the test and what tests you actually need. So we'll link you to these providers and give you these options if you want to do a collection site at home. We have just this past Monday, opened up an express check facility at the airport here in Houston. And this is an opportunity for you at the airport inside security to walk up and actually get one of two tests. You can get a rapid molecular test, which will give you results within 18 to 20 minutes of your departure trip. Or you can actually get the polymerase chain reaction test, also known as the PCR test. That test actually requires about 24 to 48 hours for those test results to be returned to you. But the beauty of this, having this test facility inside security at the airport, is that we had a lot of our customers travel through the airport and not have the correct test and did not have the correct documentation. And they may be from out of the country, they may be from out of the city, and we would have to send them off to try to find a place, a hotel to stay, transportation to a clinic to get a test, and then get their test results and try to come back and collect on another flight. Or we may just have to send them back home. And that was really a pretty big inconvenience for our customers. And so as we try to make our way through COVID-19 and open up the borders and the economy and get people traveling again, this became a great opportunity for us to offer this to our customers. In the United system, this clinic is available also in Denver and in Newark, and hopefully in the very near future in our Washington Dulles facility as well. So once you walk into the facility and you kind of hit the curbside and you start walking in, you're going to start seeing here, people really want to help you. They want to assist you. Everyone's going to be wearing a mask. This is a customer wearing a mask getting ready to check in. As you walk into the lobbies, you'll see that we have the traditional sneeze guards. You'll see all our customers are in masks because you are required as a customer wear a mask. I know that the CDC is starting to relax some of those guidelines. I know that, like for here in the state of Texas, we're starting to relax some of those guidelines, but it is still a federal mandate that you wear a mask in all of the US airports. And we require as a United customer that you continue to wear a mask. We believe that that's good science, good data from the CDC, and we are not ready to relinquish or release some of those restrictions at this point. These are just pictures, go back one, Cyrus. Those are just pictures of our agents at the ticket counter. And again, they're wearing masks with sneeze guards. We recognize that you cannot always be 6 feet away from each other. If you want to help each other, you need to be social distance or shoulder to shoulder in cases. And so you'll see that we take precautions to make sure that we are doing that. We introduced touchless kiosks, one of the first airlines to actually do that. So you can walk up with your personal device, you can scan it, check in, print your bag tags, Do everything you need to do without ever touching that kiosk, just from your own mobile device. As you move your journey on through to the security checkpoint, you'll see that all of the TSA business partners that we have working with us have installed the sneeze guards as well. Great social distancing with the stanchions and the sneeze guards to make sure that we have the proper hygiene and distance as we keep people safe as they travel. Another picture there as well. This is a great picture here. I just wanted to highlight one that our business partners with Clear that help you expedite your screening through the security checkpoint are back on duty with a smile. And then on the left, you'll see some of our TSA security officers here in the States, along with our four-legged friends, also on duty and ready to assist and help you as you walk through the lobbies here in Houston. And we've taken some precautions in the airports. We make sure that all of our employees at all times wear masks and take their employee temperatures. And we've provided facilities right here. So if I'm an employee walking in, it doesn't matter if I'm a ground agent, flight attendant, or pilot, office worker. First thing I do is make sure that I get my temperature checked. And if I'm in the green, I'm good to go. If not, I'm heading back out the door and headed home. Once you kind of get through to the terminal, I just wanted to show you here on the concourse, you'll see as you look through these pictures, everybody has a mask. I just can't remind you enough that the precautions that we're taking to make sure that we have the social distancing where possible, wearing the mask, sanitation stations. But here's a nice picture to show you that almost 70% of our concessions are now reopened in the airports here at IH. When we first went into the pandemic, we didn't have any flight activity. We didn't have a lot of people flying. The concessions were closing down. You'd walk into the airport and you'd want to find something to eat or drink. You couldn't find anything. It's good news that we're back up and flying today. So just some more pictures of the concessions. And then here's one of the workers at the concessions. And here, this person actually works at the bar. And because he's not 6 feet away from you, he's taking the extra precaution of a mask and a face shield just to protect you and himself. And if that picture, I blew it up, he'd have a thumbs up, giving you a good sign that life's good and we're moving forward. We threw this picture in here because here in the States, everything's about Starbucks coffee. You can't survive without Starbucks. So we wanted to make sure that we threw this in there, let you know it's up and running. But you'll see some of my employees on the right over here in the yellow, they have on their masks. You'll see on the floor, all the signage, distancing signage on the floor in the queues to make sure people are social distancing as well. Now, we've talked a lot about the electrostatic spraying that we actually do on board our airplanes on every turn, on every RON. But here in Houston and throughout the United facilities, we actually do electrostatic spraying in our facilities as well. And this is a live shot of our employees actually going through and spraying and wiping down the equipment and the gate hold areas. This company that works with us is called JPS. They've actually branded themselves as disinfectant specialists. Trying to make sure that every surface every day after every flight is wiped down and cleaned. And the same protocols fall in place in the club. So you can walk into our United Club, you see the sneeze guards and the mask and touchless card readers and everything there as well. This is the boarding gate. So now you're actually at a gate. And I like to show this picture because we have a lot of signage up on the sneeze guards. These 3 customer service agents are actually smiling with their eyes. We talk about that a lot because you can't see their face, but we still have great customer service. And then on the right, this gentleman is actually one of our customers, but he really was excited about joining us and participating in this picture because you can see from the boarding gate up there, he's on his way to Liberia and he was going on vacation. He's been cooped up for a while. So he has a smile on his face as well. When you get to the gate, you'll see that we're using a lot more touchless opportunities through biometric boarding. You'll see that we actually, that's on the far right, you'll see the scanner. You'll see on the far left, the biometric boarding where you can actually go and get help from an agent on demand. You can hold your phone right up to that QR code and talk to a live agent on your mobile device. Here's just a picture of when you board. You can board yourself and we won't touch your phone. You can do it all yourself behind the sneeze guards. Customers all in their masks. Now you're getting on board the airplane. And once again, like I said, we're going to disinfect every single airplane. We're going to wipe down the seat tables and the trays and the window shades and the air gas vents above your head. We're going to make sure that that plane is really clean, and we're going to use electrostatic spraying to make sure it's clean every turn, every RON at night. We've talked a little bit, excuse me, about the hospital grade HEPA filter that we have on board our airplanes. This is a picture of it here on both the left and the right. We actually take this picture, and let's go back, Cyrus. We actually take this prototype and we've put it in the queues and the security checkpoints in our terminals because people want to know what it is and what it looks like. So we have these on display so that people can read up on them. And if you look on the far left, you'll see a QR code down below. Once again, you can pull up additional information about the HEPA filter. These HEPA filters filter 99.7% of the particulates off board and out of our airplanes each and every flight, every 3 minutes. Okay. Now you're actually boarding the airplane. And so even though we've gone through and we've given your airplane and our facilities a hospital grade cleaning day in and day out, every flight, we will still offer you a sandy wipe as you board the airplane, because we recognize some people still want to wipe down their facilities again by themselves. And so we want you to feel safe. We want you to feel comfortable flying on board the airplanes. So we'll give you a sandy wipe to use. We will also offer you a mask if you don't have a mask. We will require, as I mentioned before, that you wear a mask for the whole duration of your flight. That's to protect you, excuse me, you and the people sitting next to you. Go ahead, Cyrus. And I recognize that this new environment that we're working in today, there is a lot of change for everybody. And so with the change that comes with the new COVID environment, we're also changing our policy. And so you see that we're changing and getting rid of the change fees on flights between select markets, because we recognize you need the flexibility on your travel plans, business or pleasure, to stop your travel plans to go home and take care of family if they get sick, or your meetings, your business meetings may change. And so we've offered this flexibility as well to you. And so I guess with my last slide, as I choke through this with you, I just want to let you know that we are open for business. We welcome you back. We have an environment for you here that I think you will find safe, and we're ready for you to come back and visit us. So thank you very much for that.
That was really great. That was very comprehensive. Thank you for kind of taking us through that journey from terminal to plane. I would love to hear B's perspective from the airport operations perspective. So B, I'll hand it over to you.
Thanks, Aida, and good afternoon, everyone. And Rodney, good to meet you finally. And your presentation rekindled some memories for me, because I was the general manager at Bush Intercontinental for a couple of years before I became the chief operating officer for the Houston airport system. And then Atlanta came, roped me in, and dragged me back, screaming and kicking all the way back to Atlanta to take up my position here in Atlanta. So with that said, let me just go ahead and pull up my presentation. So you will hear it from me, and you will hear it from many, many across the nation. The world changed 1 year ago, and it changed in a drastic way. Atlanta was one of the first airports required to address those changes, as the CDC determined that Atlanta was one of 6 airport tasked with serving as a gateway to the nation. When the virus became dominant in the country in the early 2020, Atlanta focuses on multiple programs, standards, and processes to build and reinforce. And you will hear this theme from both the airline and airport to build and reinforce the confidence of the traveling public. And first and foremost. Secondly, to keep our employee, and thirdly, the community safe. From the beginning of COVID-19, my primary goal with my team members was to keep our staff safe, ensure that they're protected, for the very simple reason that we need them here at the airport to be able to make the adjustment in what I consider 3 functional areas for the reduction of operations because we see the reduction or air travel dropping significantly. And we know that there's going to be the eventual resumption of air transport activities. So the three areas that we concentrated on here in Atlanta at the early stage of the pandemic was our infrastructure, the operations, and finally the legal requirements. So let me talk a little bit about what we did from an infrastructure perspective. So from an infrastructure perspective, as Rodney had mentioned in his presentation, one of the dominant focus for us was passenger safety. And we needed to determine how and when and why what we will do with our infrastructure. So the very first thing we did was to harden our facility by adding, and you will see this across the nation's airport, plexiglass at airline ticket counters, security queuing areas, concessions counters, and throughout the airport to ensure that the customer have a protective barrier and a social separation between each other to prevent or minimize the spread of the virus. The second thing we have done here in Atlanta was uh, we understand that communication is very, very important. And so what we wanted to do was to have a widespread awareness program in place for our traveling public and even our community to be aware of what we here in Atlanta is doing. So we installed signs throughout the airport. We change our messaging and our public address system to inform what's going on and the protective measure Atlanta is taking to ensure the safety of the traveling public. The next thing we looked at is the physical safety of the traveling public. Atlanta, I think, was one of the first airport to install touchless hand sanitizer. We place over 500 sanitizer throughout the airport um, uh, to ensure that the passenger have a method in place within a few step walking distance to sanitize themselves if they feel that the surfaces that they're touching may transmit the virus to them. And so we spend an awful lot of time determining the appropriate placement of these hand sanitizers. Um, in addition, as you can see in the picture on the left there, we add a social distancing sticker. We place over nearly 4,000 stickers throughout the airport for people to maintain that social distancing to protect each other from the virus. And the last thing we did, in addition to what I just mentioned, is mask requirement. Atlanta was one of the first airport to institute a mandatory mask requirement in the airport. And we realized that not a lot of people will have masks in the early summer of 2020. So we stockpile over 4.6 million masks in our warehouse, and anyone coming to the airport that did not have a mask was given one or two or however many masks they want for free. Um, with the distribution of the mask, I think it encouraged the traveling public to don the mask because it was readily available to them. The second element that we concentrate on was our operations. At the beginning of this pandemic, we knew that, and we saw the significant drop in passenger and flight operations, and we knew that our air carriers will need parking spaces here at the airport. And so what we embarked on was to provide available pavement for aircraft to park. Atlanta has 5 runways, and the very first thing we did, without the approval of FAA, closed one of our runway. And eventually, I got in trouble for that because the FAA mandate, they came out with a mandate that we have to have their approval because of federal dollars we receive to build airport to get their approval whenever we take away active operational area. We closed the runway and several taxiways, and you could see this is a snapshot of some of the aircraft that was shuttered at the initial stage of the pandemic. In addition to the reduction of flight operations, again, we look at passenger protection. And one of the areas we concentrate on is the cleanliness of the airport. And Rodney spoke extensively of what United was doing in their exclusive use space and their aircraft. Similarly, the airport was doing the same thing in public spaces. The continuous cleaning, the deep sanitization, the disinfection was ongoing 24 hours a day, 7 days a week. At night, when we cease our operations at 11:30 p.m. to 5 a.m., we go into a detailed deep cleaning and sanitization to get the airport ready again for the next day's activity. So this is not only an airport initiative, but it was also an airline initiative, and many of our stakeholders who operate here at the airport follow the same pattern, especially our concession, to ensure that we provide the utmost protection to the traveling public. And then we have a legal requirement. In summer of 2020, both the state and the federal government did not mandate the requirement of wearing a mask in public areas. Our mayor, the mayor of Atlanta, the Honorable Keisha Lance Bottom, institute a mandated mask policy for all city facilities. The airport, being owned by the city of Atlanta, fall under that guidelines. And so if you're flying out of Atlanta, one of the requirements for you to come into the airport and get on that aircraft is you must have a mask on. And as a result of that, there were some pushback by several groups, but we were able to fight them off successfly. And then, as we all know, in January of this year, the Biden administration strengthened that requirement by mandating that all federal facility, or if you public facility that receive federal dollars, must have and must wear a mask. So we were in good standing with the state, local, and federal government on this legal requirement that we institute in summer of 2020. And with that said, that's a very high level of some of the things we have done here in Atlanta to send a message to the traveling public that we care about their safety, and we are proactive in implementing measures from a structural, from a personal, and from a legal perspective to assure them to come to the airport and get on those aircraft and fly. In addition to what the airlines are doing together with airport and airlines, I think we're sending a very, very strong message to the general population as a whole.
Thank you.
Yes.
Yeah, thank you. That was also a very comprehensive. We were really pleased to know how much both the airlines and the airports are doing in your two cases. I have a question about, are these measures consistent throughout all airports, throughout, you both serve on your industry associations. So are you finding that travelers are going to face or see some of the same things if they're going into, Frankfurt or in the UK or Paris or wherever they may travel? Rodney, would you like to take a?
Sure. Thank you. I can tell you from an airline perspective, yes, you are. If you go into any of my United facilities, you're going to find pretty much the similar branded kiosks and sneeze guards and mask policies everywhere. Anywhere in the United States, as B mentioned, it is mandated by federal law that you have to wear a mask while you're on the airport property. Any airline in the U.S. is going to require that you wear a mask on board the airplane today. All of my competitors, The one thing that we have promised each other is that although we compete with each other for your service, we will not compete on safety. And as we work through different types of studies and tests to try to determine what is safe and what we can do, we share those results across with the other airlines here in the US. So I think you'll find the same thing wherever you go.
You know, as we're talking about standardization across the industry and across all, you know, the world, I recall an interview with the CEO of Lufthansa just a few weeks ago, where he said that it will soon become a worldwide standard that passengers either need to get tested or vaccinated before boarding. And you hinted at that with the clinics that I think that you have a prototype in Houston. And some people are calling this the vaccine passport or the health pass. And, you know, in the 70s, having appropriate vaccinations or health certificates to fly to various countries was sort of a norm. So in your respective industries, are you seeing that we're heading in that direction? And maybe B, can you address that question first?
So the industry have been having a quite significant discussion along this line. Both our two major trade associations, AAAE, the Airport Association of Executive, and ACI, Airport Council International, jointly and separately have been having discussion across the industry. I serve on the IAAE, International Airport Executive Airport Executive Board, where we're discussing some sort of a standardization. Right now, we have individual countries, individual states are doing their own thing, and there's a lack of both a national and a global standard. So we're trying to bring a government globally through the various regulatory bodies such as ICAO and FAA, and health officials throughout the globe to come together to talk about and develop a global standard. We here in the States are looking at our federal government for a national standard. So there's a lot of talk going on right now in this arena, but there is no timeline on developing or establishing this policy that is in place.
Rodney, what does it look like from your perspective on this notion of a vaccine passport?
Very similar to what B mentioned, working through our trade associations and our members there on Airlines for America. We are partnering up with labor organizations. We're partnering up with the government. We are urging our government to put some type of a program in place. We need a global answer to this so that we have the ability for customers to travel around the world easily. We're not at a position where we would say we're going to mandate vaccines, but you have to be able to demonstrate that you have the COVID test results or a vaccine in order to travel. If we're going to open up the borders, if we're going to allow people to travel overseas and sometimes even within the US. So we highly encourage that. We would ask the CDC to also get involved and help facilitate those discussions to make sure that we have a standard that we can live with around the world and around the globe.
Well, since you mentioned the CDC, I noted that this week, the CDC still issued or cautioned people from going back to traveling, even if they've had their vaccines. What do each of you think about that guideline from the CDC? Who wants to go first?
You want to go first? You want me to
Sure.
jump in?
I will jump in. And so, you know, our president said, let science speak for itself, right? And so to date, there have been no concrete data presented that air travel is a super spreader of this virus. We all know that air travel is probably, if not the safest, among the top 3 safest form of travel, both for your personal self and the spread of contagious diseases. And so whatever science that the CDC is using to make the determination, It would be good if us in the industry, if they share that with us, so we understand why this decision is made and we could adjust our operations appropriately. But I think, and I still encourage the general population, if you have your vaccine, and we know now that the CDC have come out and says, if you have your vaccine, both shot, you could be in close proximity of your family members or in small gatherings and stuff. So I think there is a peak of sunlight coming out of this vaccination protocol that is ongoing. I think the CDC will evaluate the effectiveness of the vaccine and hopefully in the very, very near future to give more sage advice on air travel.
I think that's right, B. I would just caution everybody that the CDC is relaxing some of the guidelines as B talked about, which says that if I've been vaccinated, I can be in face and talking to someone else who has been vaccinated. That's okay. Or if I'm going to go home to my home with my immediate family, that might be okay. But if I'm around people like in a public space, like an airport or an airplane, you don't know who's been vaccinated. And the number one thing that they've determined so far outside of vaccination is to wear a mask, because that stops the spread of the disease. And since if I'm traveling with B and I don't know if B's been vaccinated or not, I should be wearing a mask. All right. So that's the guidance, is to still wear a mask until we have masses of people vaccinated and we get a herd mentality where we can start pushing back and people aren't going to be sick. We're not there yet. So we need to be cautious about how quickly we release the requirements for a mask, how we handle that outside in the communities. I'm not making a political statement. I'm just stating that based on science, we don't have enough science to say we're ready just to get rid of masks altogether. There's not been enough vaccines distributed and people inoculated and vaccinated in the world yet today. So there's a CDC guidance that we're going to follow, kind of that science, and then we also are going to follow the mandate that we have from the federal government and the TSA that says we're going to wear masks.
Well, there have been a couple of questions about how long are we going to have to wear masks, because some people, just don't want to wear them. So from the perspective of United Airlines, if somebody refuses to wear a mask, what is your policy?
Well, I don't like to wear a mask either. And I live out here 12, 14 hours a day and I'm required to wear one, but I do it for the safety of my family and for the others around me. We have a policy that says you must wear a mask on board our airplanes. And if you don't want to wear a mask, then we can help you refund your ticket or book on a different flight when you make a decision. But we will require that you wear a mask on the airplane just to make sure that we can maintain safety for everybody. I know a lot of people say, well, then I'm not going to fly United anymore. I'll go fly on American or Delta. Well, they have the same policy, right? It's for the safety of the flying public today. So please wear a mask.
Very good. At the very beginning of your slideshow, Rodney, you were showing, I think you called it a health assessment, which I believed it to address that depending on where the passenger was flying to, there were literally like all sorts of requirements. Some places require you a quarantine, for a week, and other places require that you have the PCR tests and so on and so forth. Some countries may require vaccinations. How does a passenger go to one central place to kind of understand where do they go to understand before they book what they're going to be facing and what the requirements are?
Sure.
How do you guys keep up with it?
Well, it is challenging to keep up with it because the requirements can change. The eligibility requirements to get into each and every country are different in a lot of cases and can change on a regular basis, sometimes daily. And so we have a very robust department that stays in touch with the CDC and our geographical groups to make sure we know what the requirements are. And then we've collected all this information in our travel readiness center that I briefly talked about at the beginning. You can go on united.com, you can go to your mobile app, you can enter the link, get into the site, you can see the requirements that you need for documentation and tests for each and every country that you want to fly to. Even Hawaii, right? They require certain tests here in the States, or you're going to be quarantined when you get to Hawaii. You can see what the requirements are. You can then plan your trip. You can get your tests, you can get your documents, you can upload everything into your travel readiness center, have it on your mobile app right there in your PNR on your flight record, and then you can have it at the airport when you need it. You can even upload the fact that you've been vaccinated, and you can have a copy of your card, picture of it right there. That will suffice in a lot of cases. We're trying to do that to make sure that you have that information. So then if you leave here and you fly over to Germany, then you need to know what's going to require, what the requirements are to get back into the US. And we will provide you with testing options and locations in Germany and what the requirements are to get back into the US. We'll provide all of that for you up front before you fly.
Well, we know you're pressed on time, and we've got a whole bunch of very detailed questions for United Airlines. So what we may do is send those to you and then distribute your answers to the participants at a later time. B, if you could give us some closing remarks from your perspective on this passport vaccine and whether this uptick in travel, for example, would an airport have to be reconfigured a bit to maintain that social distancing requirement as they're going through TSA or other places? What's that going to look like if there's just a surge of everybody coming back, which we all hope there is? Unmute. B.
That mute button will get each one of us every time. Well, listen, first and foremost, Atlanta will have to get back to some sort of normalcy. In 2019, we moved 110 million passengers through our airport. In 2020, sad to say, we only moved 42.9 million passengers, a drop of 61% of our operations. Not good for us, not good for the industry. So we have to future-proof the ecosystem going forward, right? We have to build for resiliency. A couple of years ago, we were all planning for Ebola. We had a pandemic plan. We put that plan out. Ebola hit us, but it was nothing near like COVID-19. So what we are doing is look at future mitigation of something in our ecosystem of this magnitude. And Atlanta is focusing on 3 pillars right now as we look into the future that we want to discuss with all our partners: the airline, the federal government, state and local entity, and global entity, both public health and global global government. And those 3 areas we're focusing on are technology, intelligence, building the terminals and the concourses, and the collaboration for the industry to build upon what we have learned and build resiliency into the future of air travel.
Awesome. Rodney, if you're still with us and would like to offer some closing remarks, I invite you to
I will. Thank you. I'll mention a couple things and then I'll have to drop off. So thank you very much in advance before I do that. I think it's hard for us to determine what the future is going to look like and how quickly the travel is going to come back. We can estimate, we can guess, but I don't think it's fair for any of us to say we're going to return to normal, because I don't know what normal is ever going to look like, right? We can say we're going to return to new. It's like something we like to say here at United. We're going to return to new, and that new is going to be different flight structures. It's going to be different frequencies, different markets, depending on where people want to actually go and fly. It's going to depend on if it's the leisure market or it might be the business market, depending on how quickly our business travelers want to come back. But we will plan that as we move forward. The one thing that we have learned is that we need to adapt. We need to be able to adapt quickly and be flexible to the changing environment. We are developing programs. We're developing technology to allow us to do that, some of what I've already talked through a little bit today. And we will be in a position where going forward, if this hits again, we'll have a little bit more of a playbook. We often talked about, we planned for, could anything be as bad as 911 could? And we planned for, all right, how do we survive another 911 in the future, similar type event? This has been so much worse, so much worse. And we're just now saying, okay, how will we deal with this in the future? Let's get back to new. Let's get people flying again. Let's create an environment where people feel safe and they want to travel. We know they want to travel. We're seeing pent-up demand. We're seeing where people want to go and what they want to do. Very busy spring break weekend for us this weekend. So we know people want to come back. We're going to figure out how to continue to make it safe, hassle-free, and enjoyable for people. So thank you very much for having me today. I appreciate that, and I look forward to your additional questions.
Thank you so much. I really like that that theme, returning to new or back to new, because I think that is exactly what it's going to be. Thank you, thank you, B, thank you, Rodney, and thank you, the team that put this in place. And I want to thank our participants. And we've noted the questions, and we will pass them along and get you those answers. So thank you all, and have a safe and good afternoon.
Thank you.
Thank you.
Thank you.